Welcome to Section 2, Contraception 101. In this section, you will learn about approved modern contraceptive methods available in the Philippines, method-specific benefits and how they work, method-specific side effects and contraindications, and common myths and misconceptions on contraceptive methods. Here are the following modern family planning methods available in the Philippines. Low-dose combined oral contraceptives or COCs, Progestin-only pills or POP, Progestin-only injectables, emergency contraceptive pills or ECP, male condom, contraceptive implant, intrauterine devices or IUDs, and hormone-releasing intrauterine system or IUS, male sterilization or vasectomy, and female sterilization or bilateral tubal ligation. Please note that this module will not cover permanent methods, which are vasectomy and tubal ligation. Let's start with low-dose combined oral contraceptives or COCs. COCs contains low doses of two hormones, progestin and estrogen. There are two types of pill packets available in the Philippines, 21 and 28 pills in a pack. The benefits of COCs include effective and reversible without delay. It's very safe for nearly every woman. Serious complications are very rare. It can be used at any age and whether or not a woman has had children. It also helps prevent menstrual cramps, heavy bleeding, anemia, and other conditions. You just have to take one pill every day and start new packs on time for greatest effectiveness. How about possible side effects? COCs have an unexpected bleeding or spotting, especially at first time, but it's not harmful. Monthly bleeding becomes lighter and more regular after a few months. Some women have mild headaches, weight change, upset stomach, especially at first. These often go away. If a woman chooses this method, she may have side effects. Remember that they are not usually signs of illness, but many women do not have any side effects. Side effects often go away after a few months and are not harmful. If your client feels uncomfortable, seek health advice and counseling. These are the clients who should not use COCs without the doctor's advice if they have the following contraindications. Smoke cigarettes and also age 35 or older. They have high blood pressure. They are breastfeeding an infant who is 6 months old. They have a newborn baby who is less than 21 days old. They have uncommon diseases of the heart, blood vessels or liver, or breast cancer. They have experienced migraine headaches and have gallbladder disease. You can discuss other contraceptive methods that are appropriate for your client, and remember to refer them to a nearby health facility for any of the conditions listed above. Let's now talk about what you should advise your clients if they missed oral contraceptive pills. If a woman misses 3 or more active COC pills in the first 2 weeks or starts a pack 2 or more days late, advise her to take the last missed pill as soon as she remembers. Take the pill scheduled for the day at the regular time. Abstain from sex or use backup method for the next 7 days. And continue taking the pill until the pack is finished. If a woman misses 1 or 2 active COC pill in any day of the first 3 weeks or starts a pack a day late, take missed pill as soon as she remembers. Take the scheduled pill at the usual time. Continue taking one pill at a time until pack is finished, and no backup is necessary. If a woman misses 3 or more active pills on the 3rd week, take the last missed pill as soon as she remembers. Continue taking the remaining active pills until consumed. Discard inactive pills. Immediately start a new pack and continue the pill until the pack is finished. And then abstain from sex or use backup method for 7 days. If a woman misses any non-hormonal pill or any of the last 7 pills in a 28-pill pack, discard the missed non-hormonal pills and then start a new pack as usual and keep taking COCs 1 each day. Let's now talk about what you should advise your clients if they missed oral contraceptive pills. If a woman misses 3 or more active COC pills in the first 2 weeks or starts a pack 2 or more days late, Progestin-only pills or POP. POP can be taken once a day to prevent pregnancy. They contain the hormone progestin, unlike COCs which contain 2 hormones. The benefits of POP include: it's safe and very effective if used consistently and correctly. It is reversible. It has rapid return to fertility. It does not interfere with intercourse. It's very easy to discontinue. It's safe for breastfeeding women and their babies. It has very few health risks. Possible side effects of POPs. These are common when not breastfeeding. You'll have irregular bleeding or spotting, heavy or prolonged bleeding, like twice as much as usual or longer than 8 days, or sometimes no monthly bleeding at all. Less common side effects include nausea, headache, tender breasts, dizziness, and abdominal pain. Remember, side effects can often go away after a few months and are not harmful. If your client feels uncomfortable, remember to seek health advice and counseling. Progestin-only pills or POP. POP can be taken once a day to prevent pregnancy. They contain the hormone progestin, unlike COCs which contain 2 hormones. The benefits of POP include: your client should not use POP if she currently uses medication for TB or seizure, or has uncommon disease of the heart, blood vessels or liver, or breast cancer, rheumatic disease such as lupus. Discuss other contraceptive methods that are appropriate for your client, and remember to refer your client to a nearby health facility for any of the conditions listed above. What are the differences between POP and COC? POP can be taken by breastfeeding women, while COC can be taken 6 months after birth for breastfeeding women. POP has lower risk of complications such as stroke and blood clots. COCs have beneficial non-contraceptive effects like regular menstrual cycle, lighter menses, or fewer menstrual cramps. POP does not increase the risk of ovarian and endometrial cancer, but does not reduce the risk. However, for COCs, it reduced the risk of ovarian and endometrial cancer. Both POPs and COCs should be taken every day, but more important to take POPs at exactly the same time each day, especially for non-breastfeeding women. Your client should not use POP if she currently uses medication for TB or seizure, or has uncommon disease of the heart. Let's now talk about Progestin-only Injectable. It's a 3-month injectable contraceptive that contains a synthetic progestin which resembles the female hormone progesterone. There are 2 types available in the Philippines: dipomedroxyprogesterone acetate, or DMPA, given every 3 months, norethistherone enanthate, or NETEN, which is given every 2 months. Benefits of Progestin-only Injectable. It's safe and very effective. It's easy to use and does not require daily routine. It's long-lasting and reversible. It can be discontinued without provider's help. It can be used privately, does not interfere with sex, can be used by breastfeeding women, and also provide non-contraceptive health benefits. Possible side effect of Progestin-only Injectable. Headaches and dizziness, amenorrhea, abdominal bloating and discomfort, weight gain, prolonged or heavy bleeding, irregular bleeding or spotting, and sometimes changes in mood and sex drive. Remember, side effects are not usually signs of illness. It can go away after a few months and are not harmful. If your client feels uncomfortable, seek health advice and counseling. Your client cannot use progestin-only injectables if they have known high blood pressure, if they're breastfeeding in the first 6 weeks, certain uncommon diseases of the heart, blood vessels or liver, breast cancer, or long-standing diabetes or complication. Discuss other contraceptive methods that are appropriate for your client, and remember to refer them to a nearby health facility for any of the conditions listed above. Your client cannot use progestin-only injectables. Let's move on to intrauterine device or IUD. IUD is a small, flexible plastic frame with copper sleeves or wires around it. It is inserted in a woman's uterus through her vagina and cervix by a specifically trained healthcare provider to prevent pregnancy. Common types of IUDs available worldwide are as follows. These are the copper bearing, which includes the TCU380A, the multi-load, and the Nova T. Medicated with a steroid hormone such as Mirena, the levonorgestrel releasing intrauterine system or LNG-IUS. In this module, we will feature the copper T, TCU3808 IUD, which is widely used and well known for its effectiveness, ease of insertion and removal, with a wide margin of safety, acceptability to clients, and low cost. This IUD is effective for at least 12 years. Benefits of intrauterine device. It's safe and highly effective. You don't need constant supplies. It requires no action from the client. It's long-acting, effective for up to 12 years but easily reversible. It has rapid return to fertility and have health benefits. Possible side effects of IUD. After insertion, some women experience cramps for several days and spotting for a few weeks. Other common side effects of IUD include longer and heavier periods, bleeding or spotting between periods, more cramps or pain during periods, or they may get less after a few months. Remember, side effects are not usually signs of illness. They may often go away after a few months and are not harmful. If your client feels uncomfortable, seek health advice and counseling. Your client should not take IUD if they gave birth more than 2 days or less than 4 weeks ago, they have a high risk for STIs or sexually transmitted infections, they experience unusual vaginal bleeding recently, and they have infection or problem in female organs. Discuss other contraceptive methods that are appropriate for your client, and remember to refer your client to a nearby health facility for any of the conditions listed above. Your client should not take IUD if they gave birth. Contraceptive implant. Implants are small plastic rods that release a hormone in a woman's body to prevent pregnancy. They are inserted under the skin in a woman's upper non-dominant arm. The current systems consist of 1 or 2 rods. There are different types of implants. Jadel, or the 2-rod system, is effective for 5 years. Levoplant, or Sino Implant 2, has 2-rod system, which is effective for 3 years. Implanon NXT, or Nexon, has a 1-rod system that is effective for 3 years. There are a lot of benefits of implant. It's highly effective and easy to use. It's reversible. Fertility returns almost immediately after the rods are removed. It does not require any daily intake. It also does not interfere with intercourse. It's very effective within 24 hours after insertion. It does not affect the quantity and quality of breast milk and has non-contraceptive health benefits, preventing ectopic pregnancy and iron deficiency anemia. When you use implant, you might experience these possible side effects. They are headaches, breast tenderness, lower abdominal pain, acne, weight change, dizziness, mood changes, nausea or nervousness, and changes in bleeding. Remember, side effects are not usually signs of illness. It can go away after a few months and are not harmful. If your client feels uncomfortable, seek health advice and counseling. Your client cannot use implant if she has the following contraindications: acute blood clots in deep veins of legs or lungs, history of or current breast cancer, severe liver disease, and liver tumors or systemic lupus. Discuss other contraceptive methods that are appropriate for your client, and remember to refer your client to a nearby health facility for any of the conditions listed above. Your client cannot use implant if she has the following contraindications. The next contraceptive method is the male condom. The condom is made of thin, latex rubber designed to fit over a man's erect penis. It is the only family planning method that prevents both pregnancy and sexually transmitted infections. It's available over the counter without prescription. There are many benefits of the condom. It's safe and easy to use. It can help men with premature ejaculation. It's widely available and does not require provider's help. It's effective for preventing pregnancy and STIs when used consistently and correctly. There are no hormonal side effects. It's also available in a variety of sizes, flavors, and textures. It can be used as a backup method of contraception. There are no side effects for condoms. Now let's talk about emergency contraceptive pills, or ECP. ECPs are hormonal methods of contraception that can reduce the risk of pregnancy following an unprotected act of sexual intercourse. There are different types of ECPs: levonorgestrel only, or LNG, ulipristal acetate, or UPA ECPs, and copper IUD. In this module, we will be focusing in levonorgestrel and USP method, consistent with the DOH 2014 clinical guidelines. USP method consists of higher doses of pills used for COC containing levonorgestrel and ethinyl estradiol. Now let's talk about emergency contraceptive pills or ECP. ECPs are the only contraceptive method that can be used after unprotected intercourse. When used correctly, ECPs can effectively prevent pregnancy. They are safe for everyone and easy to use. ECPs do not require a visit to a health facility. Possible side effects of ECP. Some women experience changes in bleeding patterns. Slight irregular bleeding for 1 to 2 days, or monthly bleeding that starts earlier or later than expected. Within the week after taking ECPs, some women experience nausea, vomiting, abdominal pain, fatigue, and headaches or dizziness. These side effects are not serious and it does not require treatment and usually resolve within 24 hours. Always remember that side effects are not usually signs of illness. They can go away after a few months and are not harmful. If your client feels uncomfortable, seek health advice and counseling. ECPs are the only contraceptive method that can be used after unprotected intercourse. When used correctly, ECPs can effectively prevent pregnancy. They are safe for everyone and easy to use. How can you use emergency contraceptive pills? ECPs, like levonorgestrel, can be used in a single or split dose. For single dose, it has 1.5 milligrams of LNG, and for split dose, it has 0.75 milligram of LNG, followed by a second dose of 0.75 milligram of LNG 12 hours later. Within 5 days after unprotected sex, the USP method can be administered using any of the following regimens as soon as possible if available for 2 doses within a 12-hour interval. 0.1 milligram ethinyl estradiol plus 0.5 milligram of LNG, 0.1 milligram ethinyl estradiol plus 1 milligram norgestrel, 0.1 milligram ethinyl estradiol plus 2 milligram norethisterone. Remember that COCs contain different amounts of estrogen and progestins. Thus, the number of pills to be given depends on the preparation of the brand chosen. Take note that not all brands of COCs can be utilized for emergency contraception. In this table, you will see the recommended dose of acceptable brands used for USP method.